what we need to do is figure out a better way of communicating, which sounds weird, but like I actually think the problem is that we don't talk to each other well enough. And part of that problem is, I think, and this gets to a more fundamental issue we have, I think, as humans, is we want to be seen and understood, and we believe that we should speak and others should understand. Mm-hmm. As a clinician, I think you actually, if you're talking to engineers, you need to learn how to speak as an engineer. Conversely, when the engineer is speaking back to the clinician, I think the engineer needs to learn how to speak as a clinician. Most people are, and you talk to them and they're very wedded. They're convincing you that they have the perfect solution ever. It's untested. It hasn't hit reality. Nobody uses it, or maybe, their definitional customer uses it, or their uncle uses it, and they're telling you that this is perfect. Yeah. And they're wrong, right? They may or may not know they're wrong, depending on how much experience they have. And so the question isn't, do they have the perfect solution? It's, have they identified a good problem, and they're flexible enough that they're going to create the right solution as the world teaches them what that solution is. I meet a lot of physician entrepreneurs who code, right? And they do some engineering. And if you have time to go to medical school and you have time to be a good doctor and you code, and you think that because of that, you code better than someone who devotes their entire life and existence to being the best engineer they can, then you are delusional, right? There's a much better engineer out there than you are. Meet them, work with them.